Okay, so we're now ready to go back to our program. We will have another panel of patient testimonials. This time the topic is the consequences of the lack of treatment, and we will hear from Kevin, Christian, and Todd. Please take it away, Kevin.
Hi, my name is Kevin Kautzman, and I was initially diagnosed with PSC back in 1996 at the age of 14. My local doctors decided that it was most likely my gallbladder causing the symptoms, which included significant pain and discomfort in my upper abdomen area. So they performed surgery to remove my gallbladder. Within 2 weeks, they narrowed it down to PSC thanks to a biopsy collected during the surgery. They also performed a colonoscopy 1 month later and determined that I also had Crohn's disease. At that point, my local gastroenterologist decided to put me on Ursodiol, a bile salt therapy, and I remained on that for the next 20 years. In the beginning, the most difficult part of having a diagnosis of PSC was the uncertainty. At the time, doctors said that I would need a liver transplant eventually. I didn't know if that would be 2 years, 5 years, 10 years. But over the course of the next 20 years, I dealt with different bouts of cholangitis, some worse, some not as bad, but they continually got worse in my upper 20s and lower 30s, and the number of bouts of cholangitis I had was increasing. The only way they treated that was with some pain relievers and antibiotics to bring down the fever. I was often, in 2013, I began treatment at the Mayo Clinic in Rochester, Minnesota, and there I was supported by my employer at the time to help cover travel expenses because it was important for me to get to a center of excellence to get the best care possible. In October of 2016, I was hospitalized locally, and during that time frame, I had intense pain that would not go away. After a week-long hospitalization, I was sent up to the Mayo Clinic, and within 7 days, I had a diagnosis of perihilar cholangiocarcinoma, which showed no signs of spreading and was most likely at stage 2, thankfully. Had I waited another few weeks, it would have most likely had spread and been inoperable at that point. The wait for the liver transplant was difficult, over 5 months of waiting, in which case we had to relocate my family up to the Rochester area. One of the hardest things I've ever had to do during that time of waiting was putting together a will and advance directive with my spouse, when I was only 34, 35. I was called for my transplant surgery on July 5th. Today, I'm still thankful that someone was willing to be an organ donor and that my wait time was only 7.5 months from diagnosis to transplant. Things began to get back to normal in 2018. However, in 2019, after a colonoscopy, they discovered that I had dysplasia, high-grade dysplasia, and early signs of colon cancer. So they had to do a total colectomy, requiring 3 surgeries for me to get back to normal. Not an uncommon diagnosis after my medical history, or with my medical history. As I said before, the most frustrating part of having PSC and cholangiocarcinoma is dealing with the unknowns. Will I be able to continue to work remotely, or will I have to go out on leave for months on end? Can the cancer continue to grow even after the transplant? Even with all the knowledge at the Mayo Clinic, it's still impossible to predict when or if these things are going to occur. After everything I've gone through, I hope that researchers can come up with a test and PSC protocol to identify cholangiocarcinoma earlier and find a way to slow PSC progression by slowing down scarring of the bile ducts. Thank you.
Can you imagine yourself where that for a period of several years, when you wake up each morning, you do not feel rested despite having slept the night through? And then you need a midday nap just to make it through to the evening? What a way to spend your late 20s and 30s dealing with this constant fatigue because of PSC. Hello, my name is Christian, and I was diagnosed with PSC in 2004. For several years after this diagnosis, PSC showed no symptoms. Then one day, jaundice had appeared in my eyes. This had meant PSC had been causing havoc in my body. 6 months after marrying my wife and I moved to Ontario, that allowed me to be a patient of the Toronto Liver Centre. There, I underwent several tests to determine the extent of PSC. While at the hospital for these tests, I had my first internal bleeding episode. After using the bathroom, I noticed blood in the toilet. I was then immediately treated for an esophageal varices bleed. And at that time, we didn't even know what varices were. And here we were, dealing with a life-threatening one. We were so scared. Confirmation then came that I needed a new liver as it was cirrhotic. I was then put through the process to be put on the liver transplant waiting list. To help reduce further bleeding episodes, my wife and I would make monthly 6-hour trips from Ottawa to Toronto for endoscope procedures which abandoned my varices. I was also prescribed Nadadol, but it had reduced my ability to be active, just what I needed when I was tired all the time. PSC was now impacting our lives forever. As newlyweds, we'd have loved to start a family, travel outside of Canada, and fulfilled our dreams. But because of PSC, these were no longer possible. The jaundice, the constant fatigue, the endoscopes, they became our new norm. Our mental health was also being impacted, as we didn't know if I'd get the transplant call or if the preventative measures would work to help reduce the risk of internal bleeding as my varices were getting worse. For they had spread into my stomach, which meant treating them more difficult. The treatment then required special glues and coils to properly secure them as opposed to the typical bands. But despite these efforts, I had my worst bleeding episode in 2016. I had vomited so much blood with such force into the toilet that it sprayed the walls and the floor of the bathroom. I'll never forget how scared I was seeing the hospital staff rushing to my assistance. Regrettably, PSC did not stop with my varices. It had also weakened my bones to the point that I had osteopenia. A simple slip on ice in 2017 then resulted in a broken hip. This was one of the most painful experiences of my life. I needed months of intense physiotherapy to regain my mobility. I'm lucky I've survived PSC, but it's only because I had a life-saving liver transplant in 2017. I am very grateful for the second chance at life. PSC is a terrifying chronic condition that can strike without warning and has no mercy. I hope a cure can be found soon, as I'm well aware of its destructive nature, a fate no one else deserves.
My name is Todd Klauser. I am the husband to an amazing wife and the father to 2 beautiful children. When I was 15 years old, I was diagnosed with PSC. After 2 years of suffering through uncontrollable itching and maddening insomnia, I received a living donor transplant from my personal hero, my brother. Within a few days after the surgery, I developed a blood clot in my hepatic artery, causing the liver to fail almost immediately. I recall very little from the 12 days in between my first 2 transplants, but I do remember waking up with the guilt of taking my brother's liver and not being able to use it. The liver after my brother's lasted approximately 6 years before the recurrent PSC that entered its way back into my body required it to be replaced. I received my 3rd transplant in November of 2009, 3 transplants of the same organ in approximately 6 years. For years I felt good. I got married, I bought my first house, I had my first baby on the way, until one day I didn't. I came home from a business trip with fever and chills, and I remember going back to sleep on the couch. I woke up days later in the ICU on a ventilator, not knowing where I was or how I got there. I spent over a month in the hospital and nearly 2 years withering away on the transplant list yet again, this time with tubes coming out of my abdomen draining the bile and infection from my liver. For 2 years I barely lived my life. What should have been the best years of my life were robbed from me. When my daughter was born, I could barely hold her without getting exhausted. I couldn't be the hands-on dad that I always pictured myself being. I remember realizing that there was a good chance that I could croak any day and she wouldn't remember who I was. I wrote life advice for her in a journal every night because I wanted her to have words to remember me by. PSC is always with you. It doesn't matter if you're post-transplant or not. It's always there. Every time you feel an itch or get a fever, you get this little voice in the back of your head asking, is this the PSC coming back? I'm not an anxious person. I'm probably as laid back as they get. But the thought of having to tell my family that I'm having symptoms again is my biggest nightmare. Putting your loved ones through that kind of pain can be worse than the disease itself. I've gone through 4 transplants because of PSC. I make light of it by telling people I'm impossible to kill. But the truth of the matter is that every time I feel under the weather, I get this gut-wrenching feeling that this could be it. Years ago, I fell asleep with a fever and woke up in the ICU. Could this be the fever I go to sleep with and not wake up? That weighs on you, emotionally and physically, until it doesn't. This disease has tested me and my loved ones for years. It has caused so much unnecessary pain to so many people. I live with the constant fear that my kids will grow up without their dad because number 5 is the straw that breaks the camel's back. And that is a fear that no parent should have to live with.
Thank you, Kevin, Christian, and Stephen, for sharing these terrifying, painful, and surely traumatic consequences from a lack of treatment for PSC. To add some context to these stories, we'll rejoin Joanne Hatchett, Medical Science Liaison for PSC Partners, to discuss more survey results on the topic of treatment. Take it away, Joanne.
Thank you so much. For this session, let's begin with talking about a disconnect, patient experience versus provider recording. PSC Partners is working with Komodo Health, a data-driven healthcare software company, which evaluates PSC data through the use of K83.01, the ICD-10 CM diagnosis code for PSC. The red bars show patient-reported symptoms, all of which are among the highest impact symptoms discussed earlier. To find out how frequently physicians included these symptoms as part of the patient visit and coding process, the Komodo Health Insurance claims data, the blue bars, they show numbers which are significantly lower. We assume PSC patients are talking to their doctors about the effects of these symptoms and how these symptoms change how they feel, function, and their quality of life. Yet we see a large discrepancy between patient-reported symptoms from the survey versus insurance claims based on K83.01 coding usage between 2018 and 2020, which was when K83.01 began. This raises important questions. Are PSCers clearly describing the serious impact of these symptoms on their quality of life to their doctors? Are physicians understanding the depth of the patient's distress, or are they uncomfortable prescribing medications for anxiety and depression? Are physicians frustrated knowing fatigue, insomnia, and pruritus don't have effective treatments? How to bridge this gap? Patients can discuss physician symptoms with their doctor and ask them to document their symptoms. Physicians can proactively ask patients about their symptoms. Next slide, please. PSC and impact on activities of daily life. The question, when your PSC symptoms were at their worst, did your symptoms limit your ability to do activities as much as you would have liked? These numbers tell a story. 76% of PSCers cannot do strenuous activities or work, followed by nearly as many having impacts on their social life. Sexual interest or activity is something we never tend to discuss openly, yet 60% said they were impacted when PSC was at its worst, along with the ability to do household chores and work or home duties being impacted. We also see walking less than 3 blocks and driving a vehicle. Driving a vehicle, and that inability can limit participation in clinical trials. Plus, these are quality of life measures that deserve attention. They need to be acknowledged and addressed. Next slide, please. Which was first, PSC or IBD? What was the relationship of the timing between the onset of your PSC symptoms and your IBD diagnosis? It's interesting to look at the onset of PSC symptoms and the timing of the individual's IBD diagnosis. We see in the large red slice that about 50% have PSC symptoms after their IBD diagnosis. Yet about 20% of PSCers are having PSC symptoms near the time of IBD diagnosis and another 20% before diagnosis. It looks like there is not a clear causal relationship between PSC symptoms and IBD diagnosis. Over 70% of all PSCers have IBD, yet the pattern is not the same for everyone. Perhaps this is an educational opportunity to encourage community gastroenterologists and primary care physicians to ask questions about PSC symptoms in their IBD patients. Hepatologists already know the relationship between PSC and IBD, and we're grateful PSCers are monitored carefully for IBD. We'd love to work more with the GI and primary care community to develop an educational outreach program to ensure everyone's aware of the relationships between PSC and IBD. Thank you so much. Back to the studio.
Thank you, Joanne. Let's now return to live polling, please. If you've just joined us, please participate if you are a PSC patient or a caregiver. To get to the polling, you can either return to the polling tab if it's still open, or to launch the polling, find the green button that says Live Polling at the bottom of the page under the live stream window. This will open a new tab in your browser. Alternatively, pick up your phone or tablet and go directly to pollev.com/PSC-PFDD. Okay, let's start with question 1. Recently, how much have the PSC patient's symptoms affected their daily life? The choices are not at all, A, somewhat, B, very much, C, or overwhelmingly, D. So between somewhat, very much, and overwhelmingly, we see about 80% of the respondents are being affected by their daily life is being affected by their PSC symptoms, with about 40 to 50% very much or overwhelmingly, and 15% overwhelmingly. Their daily life is overwhelmingly affected. Can we go to question 2, please? Which of the following symptoms have most impacted the PSC patient's life? Choose up to 3. A, PSC fatigue. B, itching, pruritus. C, insomnia. D, nausea and or vomiting. E, right upper quadrant abdominal pain. F, anxiety and or depression. G, brain fog. Or H, bone loss, osteopenia, or osteoporosis. Not surprisingly from what we've heard, look at that fatigue.
Right. Right.
33% are saying fatigue.
Is the
itching.
driver, isn't it?
Yep. Anxiety and depression, 12%. We're seeing that all of these symptoms are affecting some of our patients.
Right. And as we saw from the survey as well, this really matches very well, isn't it, what we learned from the survey itself. But I think so many of these, of course, feed into the fatigue. But as we heard from the patients, this is not just fatigue that you're kind of tired because you stayed up too late.
Right.
This is a very deep fatigue that is, I think, difficult for us that don't have it to really understand.
Right. Jessica's description of a battery that can't be charged
Right.
even with sleep.
Right, yeah.
Can we go to number 3, please? Which of the following statements have been true for the PSC patient? Select all that apply. A, daily function is limited. B, family stress is common. C, unpredictability affects life. D, worry about the future. E, often misses work or school. F, invisible symptoms are often doubted. G, drug or alcohol abuse is often assumed. Or H, none of the above.
Right, it's that unpredictability and the worry about the future, isn't it?
Yep, the same, similar to what we've seen from the survey.
Right. But, you know, when I first started learning about PSC and heard about these symptoms kind of coming and going, and I thought, well, how nice it is that the symptoms aren't there all the time. But it's that uncertainty that is really become so, ingrained now in my thinking about how that really affects you, because it's like this ticking bomb.
It's very hard to plan. It's very hard to predict. It's hard to rely. It's hard to be relied upon, and it's hard to rely on yourself.
Right.
Okay, thank you so much for participating. And please continue to respond to these polls throughout the day. You can leave this tab open and simply return to it when we launch the next polling section. Dr. Miller, our next live panel is ready to join us to continue our discussion on consequences of lack of treatment. Viewers, we invite you to join the conversation by submitting online comments or calling in at 703-844-3231.
Thank you, Mary. Thank you, panel. Thank you, Niall, Nicola, Monica, and Alison. Thank you for joining us. Alison, let's start with you. You want to tell us a little bit about who you are and the status of your PSC journey and what it means to have this visible and invisible disease. And I think we have a slide actually to illustrate some of that.
Okay, sure. I'm Alison. I'm from Calgary, Alberta, Canada. I was diagnosed with ulcerative colitis at the age of 5. Then PSC at 15, and then I received a living donor transplant from my sister at the age of 31. Invisible versus visible, it was a long journey. Before I actually received my transplant, I was assessed 3 times. But I was so scared of getting the transplant, I downplayed the symptoms for quite a while to the doctors, even though I was basically living my own personal hell on earth.
Wow, look at that picture. Wow, yes.
It was a very secretive, quiet thing for quite a while until I really started showing the symptoms. But PSC robbed me of the best years of my life. My friends couldn't understand. I'm a very sociable person. A lot of times they couldn't understand why I didn't want to go out and do things. I was embarrassed to wear skirts or shorts or anything like that because my legs were literally a war zone with open wounds that it hurt to have a shower on a daily basis, even because it just burned so bad. I'd scream every morning having a shower because the pain was just unbearable. I wasn't sleeping at night at all. I'd be up until 4 o'clock in the morning, usually every day. And by the time it was time for me to get up and go to work, would be about the time I'd fall asleep. It was just unbelievable, the things that were happening. And then when it became visible, as you can see from my picture, I was so yellow. I had people asking me, believe it or not, if I was wearing yellow contacts. It was absolutely humiliating. And this was when I was in my 20s. People asking me if I was wearing yellow makeup. It was just unbelievable. I would have nosebleeds randomly out of the blue. It didn't matter where I was, if I was on public transit, things like that I couldn't stop. I always had to have a large amount of Kleenex in my purse. Random nausea out of the blue. I'd get sick to my stomach, and then, you know, if someone happened to see it, they'd think I had the flu or something contagious, and why was I out and about if I was sick? yeah, I was losing weight so bad, but my belly was getting distended. And at first I didn't realize, I thought maybe because I quit exercising that I was starting to get out of shape. Well, in turn, it was the fluid of the ascites that kept building. There was just all sorts of things. I was walking across the street one day and I just literally collapsed in the middle of the street. And I know it was just my muscles had been ate away so bad. I was randomly falling out of the blue. There was a lot of things I kept to myself that I didn't want my family to know because they worried so much as it was. And it was very hard. But when it became visible, then some of the truth did have to come out.
Right. What kind of stigma did you face?
Well, a lot of people, made comments like, well, if you don't eat properly, or they assumed that you've got, once I started turning yellow, they assumed even that I had something contagious. People in public didn't want to be near me because I looked like I was some sort of freak show. People again assume that you've been drinking, you haven't looked after yourself. I did nothing but look after myself my whole life. I was never a drinker or into drugs. I lived a very clean lifestyle like the rest of us that have this condition.
Right, it's that association with the liver that makes so many people just assume that you have done something to your liver and not that your liver's doing something to you, and something that you absolutely have just no control over. Thank you, Alison, for sharing that with us, and we'll come back to you. I'll go to Niall now. Niall, you are in Ireland, and we would love to hear from you.
Yeah, my name's Niall McKay. I got diagnosed with PSC in 2015. I had a young doctor who was delighted with her diagnosis because she knew what it was, and it was her first big diagnosis, but I had a very different experience of finding out that I had PSC, particularly when they wheeled in the surgeon to tell me that, and at that time, of course, the statistics were wrong, but they basically told me I had 10 years to live at that stage.
Wow. So why have you moved to Ireland?
Well, I have healthcare here, really helpful, and I moved back just over in 2017 to Ireland. I'm with the liver transplant unit in St. Vincent's Hospital here. They are excellent, they're a really good unit, and I get infections every 3 to 6 months, so I will be I am hospitalized every 3 to 6 months. And like other people have said, I have no idea when this disease is going to strike. So I have here my little go bag with my files in it. I got a set of headphones, a charger, so I'm ready. Set of flip flops for the hospital. So that I'm ready to go at a moment's notice, and my medication, of course, and a baseball cap because I get very sensitive to the light when I get a kind of a PSC attack. And one time I put the sheet over my head, and the nurses didn't like that.
Wow! So you take a baseball cap to the hospital with you to protect your scalp.
Yeah, well, one time I put the sheet over my head and I heard a nurse running from the other side of the ward going, "Oh, no, you can't do that."
Wow.
So,
yeah.
So, yeah.
Wow. So tell us a little bit about what it is like to have a bout with cholangitis.
Well, I guess, the thing is that the disease is different for many people, but I get these rolling infections. So I am very healthy at the moment. I'm very energetic. I'm cycling. I saw the transplant doctor last week. He's like, "You look great." And I'm like, "Yeah, but the next infection is coming." So I know it's coming. And it seems to be on this schedule of 3 to 6 months. So once I begin to slow down, and I go through a period of about a week where I don't know whether or not I should call the hospital or not, or whether I should go in. Am I sick enough to go in?
But your bag is always ready.
Yeah. And last time I went in, and on the Friday I was pretty good, but by the Monday I was yellow. I lost over a stone and a half in a couple of weeks. And that time I was listed in Ireland for the transplant. So, if you're lucky enough to be sick enough to be listed for a transplant, that's kind of where we are. And the thing is that, I'm a former science reporter, and I do the podcast for PSC Partners. But the thing is that, transplanting a liver to solve PSC is like changing the engine in your car because your battery is gone. It is complete. It's a huge job. It's kind of not, and actually, it's not really solving the problem. The problem could be with your alternator,
Right.
And that's why we get a recurrence. We get often people with PSC get the disease back, and that's if you're lucky. If you're unlucky, it's like burning your house down, because so many of the times, either people, there's a 20% chance of people who are on the list not making the operation, and then there's a 10% chance of people getting the operation, not making it through the operation.
Right.
So, a transplant to solve a disease that, is curable. This isn't even like COVID. This is a curable disease, and autoimmune diseases are on the rise. PSC is on the rise. We're going to see more of it, and we need more research into what's causing it. Whether it's the microbiome or the blood stomach barrier or whatever it is. But they are making progress in it. But it's a solvable disease. And just think that each patient who goes through transplant, I mean, I don't know what the figures are, but it must be, near $1 million by the time you're done. 5 surgeons, 4-hour operation, transfusion,
Right.
stays in the emergency room. So,
And if it's from a living donor, it's the other person as well, of course.
exactly. Yeah.
Right. Yeah. Well, thank you, Niall, for sharing that, and we'll circle back to you again. And you mentioned that you lost 1.5 stones. Would you translate that for the rest of us before we move on?
I don't know, 80 to 90 or 95 pounds to 80 pounds.
Right. Okay. Good. Thank you. Nicola, we are now coming to you. Tell us where you are at.
Yes, hi, I'm Nicola. I'm here from Boston, Massachusetts, and I am a post-transplant recipient. I was diagnosed with PSC 16 years ago and was lucky enough to receive a living donor transplant from my brother 11 years ago.
Wow. Tell us a little bit about that experience of getting a liver from a living donor and the experience after, the before and after experience.
Yes, I think a lot of people have touched on the disease itself, but there's also a huge side of it with having a living donor and dealing with the guilt of putting someone through a surgery to save your life. And I'm one of the lucky ones that had someone that was available to and matched to give me half of his liver. And for that, I'm forever grateful. And there's really no thank you can give to someone that does that for you. And like many of other people have said, post-transplant life isn't completely free. There's lots of issues post-transplant that some of us face, myself included. And I think the biggest issue I'm facing really is around strictures from the liver transplant itself, tissue being built up. And that gives me lots of complications. I have recurrent infections, a lot of recurrent cholangitis. I've had multiple brains. And now, most recently, I'm on long-term antibiotics, which obviously has its own side effects.
Right.
And that's a stress on my family. I'm a mother of 2 young boys, and I never know when the next cholangitis infection is going to strike, how long I'll be gone for. Will I need surgery? How will my husband take care of my kids?
Right.
But I think the biggest stress of all for me and most post-transplant people is the chance of recurrent PSC showing up on those scans. And that's a fear. And that weighs on my mind daily. But the thing that helps with the fear is my hope for a cure. And I know that with this group here, we can do that. I'm looking for a cure for the disease, or at least something that can help the treatment, help the symptoms, and give them the treatments a better option. I think we need a treatment for the itching, the varices, the fatigue, the insomnia, the pain, the infections. When the itching was at its worst, I'd find myself sitting in a bathtub full of ice all night, scratching myself just for a few minutes of relief, or going out on the sidewalk and clawing my feet on the pavement just for a few seconds of relief. It's an invisible illness, but we know from what happens behind closed doors and in medical appointments that it's not invisible. We need something to erase it, or at least something to ease the symptoms and let everyone get back to what their version of a normal life is.
Right.
I'm hopeful that my story can help support those that are fighting and provide inspiration for those to keep fighting the good fight so that we do find a cure.
Right. And all of you are so much participating in that call and that fight today. You mentioned I cannot imagine what that is like, but you mentioned sitting in a bathtub with ice. Niall, I've heard you talk about the itching, and you do something opposite to that. You need to unmute yourself.
The last time I got home from the hospital, I had terrible itching, and I would either take very, very, very scalding hot showers, or I would put my hands underneath the water, just to give underneath scalding hot water from the sink, just to give myself some relief from the itching. It's unimaginable how bad it is.
Right, right. So whatever, I mean, these are such drastic measures to take and really illustrate the need. If there's one symptom, this would be one to really try and have a treatment for. And of course, all the others as well. Monica, we're now coming to you. Tell us about your life and your child.
Yeah, hi, I'm Monica. I currently live in the San Francisco Bay Area. I was diagnosed 12 years ago at the age of 29. I currently live with my husband and my 5-year-old. And currently my work is in flux because unfortunately I'm the fear. Like I was diagnosed with recurrent PSC last year, just 3.5 years after my transplant.
I'm so sorry.
You know, I was lucky enough to have a transplant. I did have a deceased donor transplant. I was doing fine. My doctors had really, when we talked about pregnancy, said we need a period of you doing well before we'd be on board with that. So we waited. I had that. I had my son. And then after that, I had a really rapid decline. So I was waiting for my transplant, and he was, when I had my transplant, he was 20 months old. While I was waiting every night, I would put him to sleep and I would say, if mommy's not here in the morning, just know that I'm working as hard as I can to get back to you. And I would just whisper that in his ear. My fear was that I wouldn't come back. As Niall pointed out, not everyone makes it through. So I was glad that I have made it through. I did have a second chance. Had a pretty long recovery, and there are many things that go into that. I processed a lot. I'm an artist. I'm a photographer. I'm an artist. I processed that by listening to other people's stories. I started a podcast about other parents with PSC or parents of PSCers. I've processed through my photography, sort of my journey. I did have a wonderful job that I worked at an arts high school. And I remember sitting down with my boss and saying, you know, I have PSC, I have this job that's intense that I love, and now I have a baby and I can do 2 out of 3. And I want to say bye to PSC. I want there to be a cure. There's not. I'm not getting rid of my son that I work so hard to have and love so much. So I have to say goodbye to my job. So, you know, I have been trying to do photography on my own, but also I know that stress is a huge trigger for me.
Right.
So part of my not working full time is decreasing the stress in our family and trying to make it through. Now with recurrent PSC, I've had some of my first hospitalizations. I did not have hospitalizations before my transplant. Recurrent PSC does not have the same path. For me, it has included a trip for sepsis. It has included cholangitis attacks. You know, and they were already talking about my second transplant. They're already talking about a living donor transplant because of the change in the MELD system and the likelihood of how sick I would have to get in order to get another transplant. So, you know, that affects our whole family. It affects where we live, and we have to be near a transplant center. It affects jobs. My husband, even if he's in a position where he wants to leave his work, the first thing he asked about in his new job when they offered him a job was, what's the health insurance? What does it cover? What's the phone number? We need to make sure it covers my wife's treatment, because without insurance, then we're toast. I mean, I know people who were not able to have a transplant because they could not afford it. So I know that I was very lucky, and you know, will I be lucky again? Will I get a third chance of life? Will I get to watch my son grow up? Those are the concerns that I have. How will I decline this time? That's my question, right? The wasting of it. Talk about itching. I mean, one thing to understand, this isn't skin itching, it's blood itching. Like, your blood is itchy. The bile is in your blood. Like, you can't reach the itch. You know, some people gave me credit because I didn't get an epidural with my birth, but I got it because they told me that epidurals can make you itchy. I was like, no.
Oh, wow.
I would rather the birth pain than you give me something that's going to make me itchier. And recurrent PSC, that's as soon as that came back, oh, what heartbreak.
You have all just made that so clear to us, what that means. That incredible thing that you can't reach. We do have some callers, so stand by. Let's take some callers to make their comment. We have Eric from Vancouver. Eric, are you with us?
Yep, I'm here. Good morning from the West Coast.
Good morning.
Here in Vancouver, British Columbia.
Good morning.
Morning. Yeah, I wanted to talk about, I am 4 years post-transplant. I wanted to make some comments about my challenges on liver transplant for PSC treatment, and all of the episodes that I've been through. And there has to be something better here, you know. So first of all, successfully getting to the stage of having a liver transplant, you literally almost have to die, or at least I did. And most people that I've talked to are in the same boat. I had to suffer with merciless symptoms, miscommunication, rumors of cures for years before I knew I had PSC. So I had a lot of symptoms and not even knowing that I had PSC. Then I was diagnosed in 2014, and I lived for 1.5 years after knowing that I had this. And I ran for over a year on a mortality rate of 90 days.
Wow.
So, yeah, there you go. And it's a very ironic and frustrating process to get through, to get to the operating table for a transplant. Yeah. Once you know that you have PSC, you get scored on severity and need for a transplant. It's called a MELD score. It's basically based on your blood chemistry. If you're healthy, your score is usually 6 or lower. My score on February 2015 was 36, so very critical.
That is critical
I
indeed.
was listed for a transplant. Yeah, I was listed for a transplant. They called me in the top 10 in the region. They didn't tell me I was number 1 or number 10, but so I was quite excited that I was going to get this disease under control. I had all these perceptions of coming out the other end extremely healthy and ready to get back to life and get back to my family. I am a family man, and I have 4 kids. They're now adults. So over the course of getting listed for the next 30 days, I went through a rigorous change of my medications, diet, and exercise, and my score started to fall. So it fell below 25. I was excited about that. Maybe I didn't have PSC. Maybe they were wrong, you know. So the doctor came in and talked to me about my score falling, and he said, yeah, this is very good, and you do have PSC, but it looks like we're getting it under control. The bad news is that you've fallen down on the list of getting a transplant because you're healthier than a lot more other people.
Well, that certainly doesn't seem fair, does it? That you are actually... yeah, go ahead.
Yep. Yep, you're telling me that, I'm not going to get a transplant now because I've improved in health. And he said, yeah, you're right. You got to get sicker in order to get a transplant. And not only that, you have to follow this rigorous plan of medication, diet, and exercise. So and I still have the symptoms. So I still have itching. I got, the mental brain fog, lots of fatigue, and still trying to do my job. I worked full time, pretty much through this whole episode, and then I was relieved when I got to do a transplant, and it had to be through a live liver transplant. I couldn't get my score above 25. So thank God there was someone willing. It was a friend of the family and a hero now to the family.
So you did have your transplant, Eric? You did have your transplant?
I did have my transplant.
Good.
Yeah. That was August of 2016. And it wasn't a good experience. I was revived on the operating table 3 times. I got an infection. I was in ICU for a month and a half after my transplant, and already discussed lots of symptoms after having a transplant. So I don't wish a transplant on anybody.
Thank you so much, Eric. That is for your insight into this. Just the waiting. The fact that you have to get sicker, and if you do your job in getting better, it actually takes you off the list. That certainly doesn't seem fair at all. But we've heard so many similar stories as yours in terms of, this is not an easy thing to do. For anyone that thinks getting a liver transplant is just, you just get one and then PSC disappears, you really remind us that that is not the case. Let's bring in one more call. We do have Sandra from Illinois. And Sandra, are you with us?
Yes. I'm Sandra Burke, and I'm from Illinois. My son, Philip Burke, lived with primary sclerosing cholangitis for 19 years until his death in 2013. And
so sorry to hear about that.
On and off the transplant list several times, improving and then getting worse. And being called and then getting to the hospital and finding out that either the donor liver wasn't good enough or he had been second on the list. He was only 40 years old when he died. He did have a number of years when he was well and didn't experience a lot of symptoms. He was actually diagnosed when he was a college student, and he donated blood, and they discovered his liver enzymes were elevated. He had the usual symptoms we've been hearing people talk about of itching, jaundice, and severe fatigue. He also had severe osteoporosis, portal hypertension, ulcerative colitis, and progressing cirrhosis. He was able to be married, have children, and at the time of his death, his children were 11, 15, and 18. He was very involved in the organization, PSC Partners Seeking a Cure. And he worked with Sandy on the Facebook group.
Wonderful.
Also created a nonprofit organization titled More Than Illness.
That sounds really wonderful,
times,
Sandra.
One of the most difficult.
Right. Have we lost Sandra? think we've lost the audio for her. But thank you, Sandra, for sharing that. I wonder if, Mary, if you have some additional comments to read from what's coming in from the internet.
We have many comments, and we're not going to have time to get to all of them. So do remember that all of these comments will be available in the voice of the patient report. So keep the comments coming. Okay, Serena from Ontario sends in this. My husband was just diagnosed with PSC. We are both physicians. Despite our knowledge and training, the PSC diagnosis is terrifying and overwhelming. The unknowns are by far the worst part of this disease. If he gets a transplant, will he be okay? And of course, the horrifying thought of cholangiocarcinoma, which is often caught too late and takes too many young lives. We need treatments to slow progression and clear diagnosis pathways for cholangiocarcinoma. I mean, we've been talking about transplants and how transplants are not a great solution, even though they're life-saving. They can be life-saving, but we haven't even touched on the risk of cholangiocarcinoma, which is another fear that PSC patients live with. Here's another one. An anonymous patient writes in, it is frightening to live by myself. When I get a cholangitis attack, sometimes I could be unconscious and nobody is here to help me get to the hospital. Here's one. Heather from Pittsburgh says, it is so interesting how you can be so sick but not look sick. I can't tell you how many times doctors would come into the examination room and laugh because I presented in person so much better than I looked on paper.
Wow. That is amazing.
Yeah.
Amazing comments. And it so much matches what we've heard from you on the panel regarding the visible invisibility, regarding the stigma, regarding just dealing with this day-to-day issue, and of course, the unpredictability of how much a transplant will do for you. And we can't thank you enough for sharing all your very personal stories. It's been so impactful. Just know that what you shared today will be part of what will make progress in this field. You have done your part by sharing your voices today. Thank you, Niall, Nicole, Alison, Monica. Thank you very, very much.